Dr. Barry, it's super nice to see you. Thank you for coming onto the channel and like actually being my teacher because, well, I'm too old for Facebook apparently because I've screwed this up. Like you should make a workbook on all the ways that you can screw up social media. And I think I've covered every page.
Well, it's a pleasure to talk to you again. I first met you at Keto Fest last year. And after talking to you for about 3 minutes, I thought, this is a person who's got something to say. And so that's why I had that little talk with you that I had. And I can see that you have put that encouragement to good use because you're doing great on YouTube and Facebook. And you're helping so many hundreds and hundreds of people. And I'm very proud of what you've done. And I know you're not anywhere near finished yet.
Well, you know, it's actually quite a kindred spirit because as we both are primary care physicians, you know, on the front lines, watching those chronic diseases grow worse and worse. And like there's something in both of our hearts that say, I've had enough. There's got to be a better way.
Yep.
And, you know, I've read your book. I've looked into your following. I've watched several of your YouTubes, but also, again, I first met you when you were at Keto Fest last year. And just tried to say, how can I connect to the other people that are trying to speak my language? And
well, you're doing a good job. Keep it up.
Well, why don't you tell the audience a little bit? I think when I've connected with the physicians that have kind of stepped over the chiasm and said, okay, to hell with some of these statin guidelines, we've got a different plan. If you're sitting in the chair that I'm sitting at, you know that they're not getting better. And there's several of us that have just said, all right, I'm throwing down the gauntlet. I'm going to try something different. So usually it takes a personal story to make that the courage to do that. And although I've read your story, I bet many people on my channel just haven't heard your story. So tell me what encouraged you to say, I'm just going to do the rogue thing and say, here's what's working in my body and in several of the patients I see.
Sure. So I am a board certified family physician, and a family physician is like an internal medicine doctor who's not afraid to take care of kids. That's an inside doctor joke. Yeah, that's an inside doctor joke. Yeah, we're always ribbing each other. And so, but then I would be very nervous in the ICU, and Dr. Bosworth, her pulse would be 60 in the ICU. She'd be like, this is normal. I don't even mind this at all. And so I've been practicing for right at 20 years. And for the first few years of my medical practice, I was traditionally trained at a state university, allopathic medicine, MD, not a DO. And back in 2003, I would have been the doctor trying to convince you that those muscle pains you had when you took a statin were just a coincidence, that you need that statin, right? I was that guy. And I would get emotional, be like, what's wrong with you? I mean, everybody knows you should take a statin. Your cholesterol's high. You're going to have a heart attack any minute if you don't take this pill. And so only by becoming pre-diabetic and metabolically very ill and morbidly obese myself was I able to say, you know what, maybe I don't know everything about the care and feeding of human animals. And so only when I discovered low carb and then keto and reversed my pre-diabetes and reversed all of my problems, did I say, maybe a pill's not the answer for everything. And so I think that, and I've apologized so many times, Dr. Boz, to my patients who I absolutely harmed in the early years of my practice because I didn't know better. I was ignorant. And the other day I posted something about an ignorant doctor on my Instagram feed, and some lady said, I'm unfollowing you. You shouldn't call doctors ignorant. And I was like, honey, I was one of the ignorant doctors. I get to say that, okay? I'm not being disrespectful. I'm just being honest. And I'm sorry if my Southern honesty offends you, but I used to be one of those ignorant doctors. And so then I started questioning everything like you have, Doc. And I looked at everything. I'm like, okay, so a statin, it's been proven. Let me look at the research on this. And then I'm like, well, God, that study wasn't very convincing. Let me look at this study. Well, that actually showed a negative effect. Let me look at this study. And then the second thing that really triggered me about the statin studies was that in my practice, I would have about a 30% rate of people who could not tolerate statins. About 3 out of 10, and maybe a little more than that, say, I can't take them. They make me feel terrible. I can't think straight. I got no energy. My muscles hurt. My joints hurt. But then in all the published research, it was like 2%. And I was like, how is that possible that all of my patients are crybabies. And all the people in the study, it didn't even bother them at all to take a statin. And so I would try different statins. I would try different dosages, different combinations, and everybody had side effects. And then, you know, I was doing all this reading outside of my medical box. And then I discovered, I can't think of his name, but he wrote the kind of the oldest but reliable book about the cholesterol myth. And I read that book, and then I'm like, what the crap? Really? Are you telling me that everything I was taught about this is exactly wrong? And then the more I read, the more I researched, the more I realized, yeah, dude, you did not know what you were talking about. And so that kind of, it woke me up to a lot of things. And then, you know, when one cat gets out of the bag like that, then you start to question all the bags. You're like, well, does red meat really cause gout? Is eating lots of fatty meat the reason people get fatty liver? I don't know. Let me go back and look at the research again. So it's really a wake-up call, and it's a paradigm shift. It changes how you think about everything.
Powerful. I mean, I'll tell you that there's so many parallels in what you just said, where I can remember the almost like counterculture feeling of saying, patient has pain, yet I'm going to say out loud that you should keep taking the medicine because the guidelines tell me you should. And every mentor said, you got to push through this. You got to let's go to the water soluble statin. Crestor's water soluble. It's going to be less joint pain. And you're like, I did that. They still had joint pain. This isn't right.
Yep.
And it's a little, I do think it is that rogue spirit that says, I can't do this. I cannot do this anymore. And, you know, my awakening really came, I think, when my husband, we were in 2010, and my church was passing around a sign-up sheet to go help the people in Haiti. And I couldn't even tell you where Haiti was on a map. I was like, no, honey, I don't know what I'm doing in Haiti. Don't you dare sign us up for that. And he's like, we're doing this. I've never seen you this disgruntled about the way medicine is going or the way your career is going. You need life again. And there was somewhere in that, just like break all the rules in the sense of quit seeing patients 20 minutes at a time, writing the prescriptions that every guideline says you should, and start listening. And that's just start where your heart breaks, like, oh my goodness, I did that.
Yep.
I totally told the patient to do this.
Yep. And I take every opportunity I can to apologize for being an ignorant doctor who was also a know-it-all at the same time. The worst combination, an ignorant know-it-all, you know. And so I apologize for that, because I'm sure I harm people, and so I'm going to spend the rest of my career trying to undo that damage by helping thousands of people realize that eating the proper human diet is the way to health. Pills are not the way to health.
You know, it is amazing too when you watch how fast you can make a difference with some of the patients. That it's very like humbling, actually, is the right word. Saying, you know what, I did do the wrong thing for the better part of whatever that journey was, but I'm going to spend, just like you, the next however many decades God gives us, saying, I want to be the physician who stops more prescriptions than I start. And, you know, as internists, we are the managed chronic disease. That's our gig. And if you want to see the antidote to chronic disease, you take away inflammation. Nothing seems to work better than a ketogenic diet.
Absolutely.
Right.
I agree 100%. And I think a great example that we've just been hearing about it in the news lately is the take a baby aspirin to prevent heart disease, right? And so I can remember when I was a resident, that was just becoming the big study had just been published. And I remember one of my older mentors, who I look up to and greatly respect, he said, you know, when you look into the research behind this, this is tenuous at best. But, I mean, it's a baby aspirin. What's it going to hurt? And so we all started doing it. We all started telling everybody, you know, if you're over 35, just go ahead and start taking a baby aspirin. It's just going to protect you, and it's not dangerous. Well, guess what? It turns out that actually it's more risky to take the baby aspirin than it is to take the risk of having a heart attack, because the baby aspirin can cause hundreds of different complications, including bleeds in multiple parts of your body. But for how many years, Dr. Boz, it was gospel. You take that baby aspirin every day, regardless, because that's going to protect you.
You know, the power behind that whole statement is a very unfortunate number of patients where I've taken them to the ICU with bleeds saying, yep, that's the risk we take. We're willing to take the risk because the benefits are so great. And then you get studies like that saying, oh, snap, look what I said yes to. And boy, that isn't, I've been lucky enough to sit in on some interviews for medical school and watch the aspirations that we all had when we said, I want to be a doctor.
Yep.
And, those people still exist. They're still out there saying, yes, I want to be a doctor and I want to help you. And you look at how much all of us have the spirit of saying, I want to help people. I do not want to harm. That's not just an oath you take. There's really a spirit to those people interviewing to be a doctor. Yep. And when you get to the other side saying, I was doing what I thought was right, and I totally was taught this again and again through guidelines, through I'm following the rules. Heck, there is, performance-based reimbursements that say if you have X amount of patients with an LDL above 140 on a statin, you're a really good doctor. You're going to get paid a little more. And I'm like, oh, the level of distrust for even me is become, pathologic is a word that I overuse, but I really believe it's pathologic. Like
well, it is. So all the doctors basically have this paradigm of thinking they believe these things to be true. And at some point, unless you're like Dr. Boz and I, and you just don't mind saying, oh, I was wrong. A lot of docs don't like that. And it's very, very hard for them to say, I'm wrong and I hurt people. And that's what it takes for a doctor to turn around and start to move in the right direction, is to admit you're wrong. You had it wrong and you made a mistake, and that's okay, because now you're going to try your best to correct all those mistakes you made in the past. But a lot of doctors don't think that way.
Oh, it's absolutely. I feel, in fact, one of the reasons I went to Keto Fest last year is I kept sending people to that podcast to say, you know what, the Medicare gives me like 20 to 40 minutes to talk to you, and you have like 6 prescriptions to refill. We have some other things we have to talk about, but there's this level of education that you need that there is no time in the visit for me to tell you about. Just go listen to these guys. What they're saying is absolutely helpful. And, that was the first connection where I said, okay, there's got to be a better way to teach my patients how to improve their health. And,
absolutely.
So when you look at, some of the personal journeys you've been on as far as your keto, obviously you've lost the weight, you really trimmed up, you've got a strong mind and body, but where do you think that tipping point really happened for you? Like how far into the diet?
Well, I think the tipping point that made me decide something's wrong is when I was 297 pounds and I got short of breath trying to tie my shoe. And I said, look, now that's enough. I'm 35 and I just got winded trying to tie my, the laces of my shoe. Something's got to change. And so initially I started out experimenting with the bulletproof diet, with primal, with paleo, with ancestral, and I got a few benefits, but it wasn't magical. But when I discovered the low carb and the concept that eat fewer carbs, the fewer carbs you eat, the better you'll feel. And then keto, it was magic within weeks. I was like, dude, I feel great. And I've already lost how much weight in that 2-3 weeks. It's almost magical. It's almost as if when you stop poisoning a human, all their symptoms start to get better and go away. And it's kind of like the standard American diet is a slow poison that slowly but surely inflames and kills you. And when you stop poisoning yourself, magically you get better. And it leaves doctors like Boz and I, we have to start making YouTube videos because everybody's better. Nobody has to come see me, every month or every 3 months, because they don't have those chronic diseases anymore, which makes me very happy, by the way.
Yeah, thanks be to God.
Everybody watching, you have my permission to share this video. Some docs are fishy about that, but you 100% have my permission, and I'm sure Dr. Boz doesn't mind if you want to share this on your page, on your profile, in your group, with your mama. Please share it, because the more people we reach, the more people we can help.
Yeah, that's been the one thing that when I look at the danger of, stepping out of the tradition, like, it's not the first time in my life that I've looked at what happens if you step outside the pack. but I can't tell you the number of lives I've saved this way, the way of taking patient stories, telling them without revealing their identity, really just being part of their life, and then using that data, using that just motivation of saying, you too can do this. It's really not as hard as it sounds. And you can't, that 2-week thing that you just talked about where you said, boy, within 2 weeks of being keto, they really did have an improvement. No, that's real. I've done a few experiments. I mean, I think you know this about me, but chronic illness is one thing, but brain repair is really where my strengths come out. If you have a brain injury, I actually am I'm in a hotel room right now, or in a hotel where I'm teaching for the Department of Defense on the neuroscience of addiction and brain injury and how do you repair it. And it is without a doubt that the brain injury for, I mean, pick one, concussion to depression to Parkinson's to Alzheimer's. I first add a ketogenic diet.
Yep.
And that was never part of my plan originally, but
Yep.
I've had patients where I said, here's a prescription for Prozac or one of the SSRIs. And here is the lessons on how to get yourself to produce a ketone. And I would contend that you're going to have a faster response for that mental health slump with a ketogenic diet than you ever are with a prescription that I have.
Yes, I remember a patient very well who was using the ketogenic diet to lose weight and to lower his A1C. And he was retired military and had been some devastating. He had seen some things that no human should ever have to see and had severe PTSD. And he, about 6 months into this, he said, Doc, is there any way that this diet could be making my PTSD better? Because and he said, it's way better. And this guy always brought his wife with him, and he would tell me stuff, and she'd be sitting behind him going, like, no, he's like, I'd be like, have you cut down on the drinking? Is it drinking? He's like, oh yeah, I'm doing better on that. And she'd be behind him going, like, right? You've seen that, right? And so this day he was like, my PTSD, my nightmares, or my anxiety, my anger is better. And I could see her out of the peripheral vision going, yep.
Wow.
And I was, and it gives me chills right now talking about it, because at that point I went, oh my God, what if this makes everything better? What if all of this chronic disease is just poisoning? What if everybody's poisoned by the crappy garbage? What if? And you dare to hope and you dare to dream. But when I saw his wife, who would always tell on him if he was lying, agreeing with him like, yes, it is way better, I was blown away. And I was like, man, if this is what I think it is, this is what I'm talking about from now on. And it turns out, yeah, it pretty much makes everything better.
Yeah, you and I have been in medicine long enough to be duped by the fads of this supplement's going to fix all your problems. This diet's going to fix all your problems. And, the first couple chapters of my book, I talk about how skeptical I was when I was reading the Navy SEAL trials of brain repair and brain performance and some of the stuff from MD Anderson's Cancer Treatment Center. And I'm almost like, this can't be true. I would know about this if this was true. And my skepticism of saying, there's no way this is true. And then to see the profound impact on my patients, almost with a level of guilt, like, oh, I totally didn't know. And the panacea that is promised with, oh, take the keto diet, it's going to fix everything. And I'm like, hey, don't make fun of that. You can't believe how many things are linked to inflammation and the cellular data that says, oh no, we're on the right path here. And if I go to my grave, it's going to be saying that when you remove inflammation, everything from multiple sclerosis to autoimmune to cancer to bipolar symptoms improve. And I'm not exaggerating. I'm not like, it is that much of a difference in my own practice.
Yeah, it really is. It's really amazing. I just saw a comment go by that a lady thought she was postmenopausal and her periods have started again.
The hormones,
right?
Right.
And I've heard that multiple times. And I actually had 2 women come to my office pissed off at me because they were 50 and pregnant. And they're like,
Oh.
your diet did this. And I said, no, actually your husband did it. But yes, if you don't want to get knocked up and you're going to start keto, then you better practice some form of birth control, because there's no diet that makes you more apt to get pregnant than a low-carb ketogenic diet, because it moves all your hormones in the right direction. And I've had, probably 100 women who were perimenopausal, right? First starting to have the symptoms, say, does this diet make my hot flashes go away? Because I haven't had any in a couple of months. And I'm like, maybe. I don't know. I'm learning as I go. But then after about the 100th woman said that, I'm like, yeah, I really think it does. I think it moves all your hormones in the proper direction. And obviously we're still going to go through menopause. We're still going to get old. We're still going to die. But you don't have to suffer the entire time you're alive. And I think that is the beautiful message about the ketogenic way of eating.
You know, it is. There is one of the chapters I really was dedicated to diving as deep as I could find was what happens to the growth hormone. I mean, specifically its relation to testosterone in men. I mean, you and I are both in the generation where they can't get, testosterone or injections in the gym. So then they come to the physician and think that we're going to be better at this than they are. And I'm like, no, you get that the adrenal glands and your pituitary glands are going to be incredibly better than me.
Right.
And of course they think that's funny, but I'm like, no, when I give you the injection, I take away all those micro variations that happen in a human body. But I had no idea until I dived into the research that you could really boost their testosterone production and their, again, with a woman, that the fastest way I can fix your ovarian, ovulation, PCOS, inflammatory, insulin dependent problems is cut out the carbs, man. It's really that easy.
Remove the inflammation and lower the insulin, and stuff magically starts to go away.
So let me ask a couple of questions about just how you've, again, I think on social media, we can both kind of watch each other to see that we've both integrated this into our personal lives and our family. But talk about what you do to monitor your keto diet, or I think for a chapter there, you've gone carnivore, which I would love to hear more about how that experiment has been for you. And then how do you monitor yourself? What ways do you kind of check in on your biochemistry?
For about the last 17 months, I've been eating at least 95% of my diet is fatty meat. And so I started it as a 1-month challenge on my Facebook page. And so I'll have to go and tell a little backstory. Back in the day, back when I was fat and obese and inflamed, I had severe daily reflux pain, heartburn, GERD, terrible, terrible. I took 2 Nexium every day for probably 3 or 4 years, right? And so when the Nexium drug rep came, I got all the Nexium. Patients didn't get the Nexium samples. I got them all because of my heartburn. When I went keto, that got 80% better. It got so much better that maybe I would take a Tums 2 days a week, right? Didn't take any Nexium anymore. Right. But after that carnivore challenge, after 1 month of fatty meat carnivore, it occurred to me I haven't had heartburn in 30 days, which was miraculous because it was just common. And you can actually go back and watch some of my very first YouTube videos.
I actually have.
You can see me doing the thing and clearing my throat and coughing and swallowing, trying to get everything right here so I could talk. Because when you have severe reflux, it can actually affect your breathing and you cough and you have trouble speaking. And you can see that in my earlier videos back when I was, just learning about keto. And now on carnivore, I haven't had heartburn in 17 months. And so I check blood work every 6 months, and I'm due now. It's time to go check. And I check a huge panel of blood on myself because I want to know. I want to know, what did it do to this? What did it do to this? I check all my hormones, a complete thyroid panel, adrenals, and it's all fine. Every time I check it, there's no sign of kidney damage. There's no sign of liver damage. Actually, those numbers keep getting better and better. And my total cholesterol is 350, and my LDL is 250. But as you know, most people watching know I don't care about that number. I could care less about that. What I care about is that my HDL is beautiful, my triglycerides are beautiful, and my A1C is better now at 50 than when I was 35.
That's it's impressive. You know, you look at some of the other numbers. Do you check that highly sensitive C-reactive protein? Is that one of the things you follow?
Yeah, I check. Yep. And so as far as inflammatory markers, I check the HSCRP, I check homocysteine, I check acid rates, I check a ferritin level, and a couple of more of the more esoteric markers I check too, just for completeness, because I know some vegan's going to pop up and say, yeah, but I bet your so-and-so's high. And I'm like, no, actually it's normal too. So I'm sorry. And every time I check my labs, I post them on my Facebook page so everybody can look at them.
That's impressive. Yes. You know, the HSCRP is one of those other messengers that I've been really impressed how well that correlates to their A1C. And I use that as a very powerful teaching point that, you know, usually I can get their insurance to cover that one. If you look at some of the really crappy things that you and I get stuck in, it's that, okay, we both see that the answer to fixing these chronic inflammatory problems is really about teaching how do you eat a better diet, how do you follow the things that are correct. And when you get into the exam room of, I mean, especially the people that are the elderly or the poor, the Medicare or the Medicaid, and then you try to find a code that says, hey, I'm teaching about the keto diet, it's really going to help their life. I mean, have you found an answer that reimburses you for that?
No, what I do is you can also, under the CPT codes, you can also bill for time spent, right? And so what I'll do is I'll say, you know, I spent 15 minutes counseling, and then you can bill for that, but you have to document that very thoroughly, or the insurance company will want to come take your money away. But still, even then, if you spend an appropriate amount of time with the patient, the reimbursement is still ridiculous. Doctors don't get paid to be doctors anymore. They get paid to be pill pushers. So
it is so real. Like I was just doing this workshop for the department, and watching them have such an oblivious understanding that when you come see me, if I don't get done in 20 minutes, then my office administrator would come to me. I have a private practice now, but when I was in the corporate medicine, if I spent more than 20 minutes with you and you were a government funded reimbursement, I got scolded for spending too much time with you. And then if you have chronic illnesses and I want to see you in 3 weeks to see if this blood pressure medicine works, nope, Medicare will not pay for that until it's been 6 weeks, because it's a chronic illness and you should only see them 3 to 4 times a year. That 3-week follow-up is too short. It must be an acute illness. I'm like, well, there was nothing acute. I was preventing the acute. They didn't have the heart attack, but doesn't. So then you get nothing for that reimbursement. And then you've been there too. You've got your own private practice. We've both been to the school saying, yeah, I'm tapping out, not doing that again. But it's hard. I mean, I think both of us reached for that YouTube channel to teach, because at least you can send the patient and say, go watch this. Really, I'm trying to find a way for you to do this without me going broke and, you know, the office.
And that's why I did my first few YouTube videos, is that way I could spend less time with each patient. But then I realized quickly, you know, I can help thousands of people with this YouTube channel where I can only see 30 or 40 a day at the clinic. And so I've slowly kind of morphed into thinking maybe this is where I should put the bulk of my effort, and maybe see patients a few days a month in the clinic. Because, you know, we had the clinic fire, complete loss, and we lost the clinic. Well, it's completely demolished now, and we're actually moving to Nashville, into Nashville proper. And so I'm thinking about opening a small practice in Nashville so that I can see a few, people a few days a month, but then I'll still have the bulk of my time to do this, because right now you and I are helping 1,200 people. That's how many we got watching, right?
Isn't that
and
fascinating?
So, how many months would you have to see clinic patients to see 1,200 people, right?
And how much would you have to pay a biller to get the reimbursement to actually get into the bank? I'm telling you,
you'd have to pay 12 people.
Yes, it's ridiculous. And then you say, oh, wait a minute, you didn't dot this I and cross this T when you were educating the patient, because you didn't write a prescription, so it must not have been that bad of a problem. So now you're stuck without getting paid for any of it. And medicine is broken. We both agree. Yeah,
and for any providers, I have a trick for that as well. For any providers out there, with the way we get paid is by the complexity of the visit. And so for forever, I thought that prescribing a medication, that increased the level of complexity if you prescribe a prescription medication.
Yeah.
But then I found out that you can actually say, because it's the decision making about a prescription medication, right? So all you nurse practitioners and PAs, listen to this. You're going to document considered prescription medication and the decision was made not to prescribe, or the decision was made to de-prescribe a prescription medication. That is the same complexity. That's right. And you get that point, and then that way you can actually get paid a higher level of complexity for the visit, but you just took them off of medicine, or you just didn't prescribe a medication. And you could say, I considered statins in this patient, and the decision was made not to prescribe. That is a decision on a prescription medication, and that gets you that point. So I know everybody else listening don't understand anything I just said, but for the providers out there, you're like, wait, what? Yeah. And I actually taught Ted Naiman that when we were on the low-carb cruise, and he's like, I had never heard that. And he got home and looked it up. He's like, no, you're right. You can actually get that level of complexity by not prescribing a medicine if you document that. And so you guys maybe can tell your doctor to do that.
No, I've been to that school before. So what happened when I learned that was then I had to convince every one of the coders that this was true. And I had to look it up and show them this, because I'm like, no, you don't get it. I'm really trying to improve their health, but if I only spend 20 minutes with them, the Medicare patient, I mean, if they pay us like what, 120, maybe 140 if you're lucky. And you say, well, isn't that a lot for 20 minutes? But what people don't appreciate is how much our malpractice costs, how much if you say that you're renting an office for medical purposes, boom, your rent triples. You've got a front desk person that needs to answer the phone. You can't have a practice today without an electronic medical record. Well, that's another $1,200 a month or whatever. These layers sound like nothing until you're in the process of saying, yes, I can send your prescription in electronically. Oh, wait, that's going to cost me another $1,000 a month. And I'm not chirping about the money. I'm just saying that the process of so many of our colleagues have gone to corporate medicine, and what they say yes to is they're now going to follow the office administrator who says, you know what, Dr. Bosworth, they're Medicaid. You spent 45 minutes with them, and you were booked for 20. And now the important person that you kept waiting is ticked off and wrote us a bad review. I'm like, lady, there's no way I can get everybody happy. I'm really trying to do good medicine here. Yes.
Exactly right.
Well, yeah, we could bitch about the problems in medicine for like 6 hours.
But I think it's good for people to kind of see behind the curtain why doctors do what they do. And what we're talking about right now is exactly why your doctor loves it when he or she can talk to you for 3 minutes, write you a prescription, and then get the heck out of the room. It's not because they're being flippant or disrespectful or they don't care about you. They're thinking about not going broke. And like before I had the clinic fire, Annette, I had 10 full-time employees working for me. And so I had to run and gun. I had to see patients as fast as I possibly could in order to pay all those people's salary and all the other stuff that comes with that. And so medicine is set up currently for a doctor to be in and out and write a prescription. That's how it's set up to function. And that's not good medicine. And I refuse to practice that way anymore.
Right. The education part of this, I think, is what we're bridging. And I think it is why the attraction to both of our YouTubes of saying, if I look at what are my advanced skills? Yeah, sure, I like internal medicine and complex problems, but really the skills are, I'm a really good teacher. And I think that's your skill too. We're saying, let me just cut the crap and tell you how I would teach my mom and dad. How would I teach my, best friend? And that language is they're so hungry for it to say, okay, what would you do if it was you? And if you read your book, Lies Your Doctor Told You, or my book, you can hear the teacher come out in the words to say, we are trying to figure out a solution. It's not easy. And we both probably have taken a pay cut somewhere along the lines to say, I give up. I'm not doing this the way everybody else around me is doing it. I'm going to say, let me try something different. Even if I go broke doing it, I feel, but I'll go to the grave saying I tried.
Absolutely.
Well, I have a couple other questions for you. So when I look at the leaders in the ketogenic diet, and I get a lot of questions like this myself, so I'm going to kind of push it back on you and say, do you have a couple of routines? Like when you get up in the morning, what's your morning routine that you use to be keto?
Well, my morning routine typically, I usually get up about 5:30 or 6, and I make a cup of coffee. I put a little salt in it. I put some electrolyte drops, maybe a little teaspoon of butter, and then I start reading the news. I look at WebMD. I look at CNN Health, Fox News Health. I try to look for all the news articles that may have popped up overnight that are going to distract people or mislead people. And I don't typically eat. I think today I ate at 2:35 p.m. That's when I broke my fast. And so being carnivore, just like keto, you're so satiated with the protein and fat, you're just not hungry. And so it's effortless for me to not eat breakfast. And so it helps me keep my blood sugar level and my serum insulin level very low normal for way up into the day, which helps my body be able to burn the fat that I've still got stored. And I still got a little bit. I got more to go. I'm not done yet.
Right.
But that's kind of my morning routine. I don't work out in the morning. If I work out, I'm an afternoon, evening guy. I can't work out in the morning. It's just not my style.
Mm-hmm. So when you do workouts, what are your favorite things that you do on your carnivore diet? What do you reach for?
Well, I reach for the weights because I want to get in and out as quickly as I possibly can. And I'll just tell you guys, I have severe ADD. It's terrible, right? And so I've had to build my life around this severe ADD I have, and it's much better with keto and carnivore, but I still have it. And so if you said, hey, you've got to go run on the treadmill for an hour, I would literally go jump off a cliff somewhere. I just couldn't do it. Maybe if I was listening to an Audible book and reading the news and talking to somebody while I was on the treadmill, maybe I could do it. I don't know, but I can't do that. So I'll go in and sometimes I'll just put on my shoes and I'll go run 400 or 500-yard sprints flat out, right, as fast as I can go. So it's called high intensity interval training. And then other days I've got some weights out in the barn and I'll go out there and lift really heavy for 15, 20, maybe 25 minutes. And I'm like, that's it. I'm done. I got to get back in there and get to work.
Yeah, I mean, you watch the studies behind the interval training and you're doing exactly what they say you should. You know, cellularly, you're increasing your mitochondria per muscle cell. That's going to keep your metabolism higher. That's going to keep your energy level higher. They're going to want for ketones more. So it's almost like this cycle that promotes the next step. So, yeah.
Absolutely. But I don't meditate. I don't do any of that sexy, fancy stuff that you hear a lot of people talk about. I don't sit in front of the red lights. I don't do, ice baths. I don't do any of that stuff. I just sip my coffee and try to learn something new every morning.
That's a great routine, though. And it does say that the methodology of that routine, getting up in a very specific time, having your favorites, whether it's your coffee and your news, those are comforting coping skills for just dealing with your life. And, I just get off of this addiction repair process saying, you want to see some poor coping skills? We got lots of examples of those. And when you try to example saying, no, people can really get pleasure from having a routine that feels good and that takes us to a stable place of brain health and cardiovascular health and purpose. And
yes.
your morning routine couldn't have been better scripted to say, it doesn't have to be exciting. It has to be something you truly want and get joy from and that you can do routinely. So,
yeah. Now let's hear yours, Doc. What's your morning routine?
So I have 3 sons and I am doing my best to imprint them through their teenage years. I'm also really competitive. So I've convinced them that they should go to CrossFit with me 3 days a week.
Yeah.
Again, very interval training. They only let you work out for an hour and I'm like the worst one in the room. I don't care though. I like the fact that yesterday I could only do 5 pull-ups and now I can do 6 before I need to use the rubber band to get me above the bar. And there's something powerful about when your son pridefully walks out of the gym saying, I can do more pull-ups than mom. I'm just letting them own that and I'm not going to fight them for that. So I just sent my oldest off to college. So one of those rite of passages in South Dakota, it turns out you can have in-state tuition if you go to Hawaii. Yeah.
Wow. Nice.
Whatever politician figured that out, My son is eternally grateful that the women
Thank
are
you,
half
Senator
dressed.
so-and-so, whoever that was.
Yeah, I'm like, oh, 18-year-old boy with half-dressed women, 60 to 40 women to men. The weather's great, and you're not in South Dakota. There's a beach. And,
Nice.
your parents get to have in-state tuition.
Very
Okay,
nice.
let's do that.
That's a
So
win-win for everybody.
Oh my gosh, right? Yeah, I'm not much of a runner either. The other things, I've had chapters where I've done that for a season, but I don't like it.
I don't like it either. Yeah.
Yeah, if I need a timeout, like when I'm doing, whether that's writing or just trying to work on something, if I need a break, I do a few things that you do too. I have some podcasts that I like to listen to for like enhanced learning. What are some of the nutrition things that we never learned in medical school? But if you kind of noodle around, you can find some good podcasts that you really do take it to the next level. And I'll go on a walk and listen to that. And even if I only remember a couple of points from listening to it, the walk really helps me. And that's something when I coach people with keto, I do not tell them to exercise for 6 weeks. Like I don't even tell them to walk. I said, you need to focus on what you're eating. And I want you peeing on a ketone stick and proving to me that you're in ketosis. And that's as far as we're going to take this behavior change for the first 6 weeks. If 100%. You can master that skill, I'll go to the next place with you. Yeah.
100%. Yeah. And so especially if I have a patient who's morbidly obese, I don't even say the E word for at least 6 to 12 weeks. And then once they have lost some weight and most importantly, their inflammation is better, usually they'll come to me and say, is it okay if I join the gym? And then of course I'm like, sure, it's fine. You can join the gym. Right. But I typically don't have to ask, because it's funny. It's almost a law of human nature. When you feel well enough, you just naturally want to be active. It's like it's built into us. But if you're inflamed and sick and fat and tired and you feel like crap every day, no, you don't want to exercise, right? And so even though now I feel great, I still don't want to go run a half marathon. I'll never want to do that. It's not my style. But I really enjoy my 15 minutes of hitting the weights or my sprints or going out and playing volleyball with Abby Grace or kicking the soccer ball with Morgan. I enjoy all that stuff now so much more than I did before, because I'd be laying on the couch going, oh, I will in a little bit, right? And now I'm like, yeah, let's go. Yeah, let's go. And I think when people get better and healthier, exercise comes naturally. You don't have to bitch and gripe to your patients about how you need to exercise. You don't have to do that.
Right. I completely agree that I have had let's cajole them into workout once a week, then twice a week, then 3 times a week over the course of 6 months, and we're still stuck at 0. And we've all been to this routine of saying, when they feel well, there is something like primal or something that says they really do want to go for a walk. They don't need to be the rocket star pushing their brain to that level. But I have been truly impressed and humbled by how many patients say, can I do that now? And I'm like, oh, maybe. That's not a bad idea. Mm-hmm. Yeah.
Maybe you should try that. That's a good idea. I'm glad you thought of that.
Yes, exactly. Good spin. Absolutely. All right. So here's a couple other questions. If you look at some of the history questions that because I do think that much of what we do, we can do labs to prove where somebody's at. But if you look at the history, and you're 20 years into this like I am, we've taken thousands of histories, many times where we say, yep, I see the words coming out of your mouth, but I don't believe what you're saying, and I don't think you do either. If you look at some of the histories that give you the greatest warning for somebody who needs a ketogenic diet, do you have a profile in your mind of who you say, gosh, I hope they can read the book or watch a YouTube or find a way to say, if you could see the transition I could make in you with a simple 2 weeks of cutting out your carbs, what kind of patient would that be?
That patient is typically someone who's in their late 40s or in their 50s or in their early 60s, and they think they're old. You are not old at that age, okay? And when you start eating the proper human diet, you won't act old anymore. And so that's a huge thing for me. Anytime someone is just chronically tired, chronically can't get enough sleep, my joints hurt all the time, And it's a classic thing that usually it's a female patient will say, I just hurt all over. And they'll kind of do this,
Yes.
right? I hurt all over. That's not normal. That's never normal. That is inflammation, and that is usually self-inflicted inflammation caused by your diet. And so those are the key patients, because, you know, when somebody's 85, yeah, they're going to have some aches and pains, and they're going to, you know, I mean, you're 85. And then when you're very, very young and you're having these symptoms, then you may actually have a medical or a genetic problem. But if you're 40, 50, 60, you ain't old. And if you feel old and act old, if the best looking thing in the house is the couch, you need to go keto. Okay? If the most exciting thing you do all day is eat, you need keto, because that should not be the most pleasurable thing that you experience during your day. You need to re-examine everything. If your biggest pleasure is to eat and watch TV, we got to talk. You need some keto in your life.
Absolutely. So if you look at that beginning keto person who you see in our minds, you can say, oh, if they could follow through with this, it's going to be great. But then you see them veer off course and not come back for several months, or not check in for several months. What do you think the biggest mistakes are when patients do go all in and then crash? How do you navigate that?
Well, I think for most people, because it's how we're trained in Western society. If you have a problem, you're going to have to pay to fix it. You're going to have to buy something. You're going to have to join something. You're going to have to, you know what I'm saying? And that's why it makes sense to us as people, as U.S. citizens. I've got a problem. I need a pill. The doctor gave me a pill, which I had to go and pay for. Therefore, that makes sense to me in my Western mind. That's how it works. But so, and a lot of people, when they go keto, they'll buy every keto bar, every keto powder. They'll buy everything that has the name keto on it, thinking that that's how they solve this problem. And actually going truly keto means removing things from your diet and from your life, not adding things. You don't have to buy a single thing that has the word keto or ketone on it. You just stop all the sugars, you stop all the grains, you stop all the industrial seed oils, and then you start eating lots more fatty meats. Those are the first 4 steps of doing keto right. And that's one of my most viewed videos on YouTube, is the 3 steps to start keto right. It doesn't cost a penny to do keto properly. You don't have to have a single thing in your house that has the letters KETO on them. You don't need anything, right? You just need to stop poisoning your body. And so a lot of people get gung-ho and they go buy every keto thing they can find. And then they're like, I don't know, nothing happened. So keto didn't work for me. And so then they'll come back 6 months later, and I'm like, well, tell me about your keto. And I've actually had people tell me that they put the exogenous ketones in their oatmeal every morning, and they couldn't tell a bit of difference. They didn't lose any weight. And I'm like, okay, so let's talk about that. And and so I have to basically say, no, you were doing keto wrong, because you were trying to throw a bunch of products at the problem, and that your problem is being caused by the products you're already buying. You have to stop all that and eat real whole ketogenic food. And but people who get that basic concept that we're not adding things, we're subtracting things. Right. They get that, and that they're on fire, and they do great. And it's hard to trip that person up, because they realize, no, I don't need that product. I don't need this new slim fast keto. I don't need that at all. That's dumb. That's a waste of money. I just need to keep eating my ribeye and some broccoli. That's keto. That's it. That is keto.
So do you ever have a place where you have the patient come back where they're checking ketones? Like that is, I've learned that that's one of the prescriptions that I've said, if I'm going to prescribe something, the first place I start is check you. Don't check the world. Don't look outward. Get your numbers and bring them back to me. And I found that accountability and that like biofeedback, if you would, just saying you can check on yourself. And I'm going to show you what you're going to know what I'm going to say. If you come back and you produce 0 ketones in the next 2 weeks, I'm telling you, you're eating too many carbs. Yep. Let's try again. Your metabolism is even more inflamed or infused with insulin than I expected. Let's take it to the next level. So do you find that, if you need to step to the next level, checking ketones has been a really key part for my patients?
I really find that I have two different styles of patient. Some people love to track and they love to check and they love to see the numbers. And so for that person, checking blood sugars and checking, serum ketones is invaluable for them because they get immediate feedback. Oh, look at that. I did this and then my blood sugar did that and my ketones did that. Other people say, Doc, I want you to give me a list of stuff to eat and a list of things not to eat. That's all I need. And for that style of patient, they literally go home and throw away everything on the don't eat list and they go buy everything on the eat list and they do it. They don't check anything. They don't even check their blood sugars and they do great. And so I think it just depends on the style of the person. Some people love to check stuff and some people don't want to be bothered with that. And I think both of those people can do keto and have wonderful results. But some people love to have a notebook full of notations of I eat this, then my ketones are this. They love that. Other people like me would lose the notebook in 2 days, so it's no point even doing that to start with.
Right. There a couple things that I've used in my practice I do two things that I recommend if somebody wants to say, I think I want to incorporate a ketogenic process in my clinic. Number one, I do a free community keto question and answer once a week, and it's from 8 to like 9:15, although I think I never get out there before 10, but 8 to 9:15 on Friday mornings. And anybody who wants questions and answers from a physician who recommends keto, you're welcome to come. Once they've come, sometimes I'll include them in this in a Zoom where they can like just check in and listen. But I found that support group, and there's no way to bill for it. So it's a free donation to my community to say,
Sure.
I really am committed to saying, you should be looking into this. I look at the Medicare patients that I could spend 15 hours trying to code for what it is, the value you're getting out of this, but I can't afford for somebody to bill that. I would not make any money. And why don't I just do it for free? Because then I don't have any worries. There was no pretense that I was going to get anything. But the true value of being a educating physician, which is what we do on YouTube, it's what we're doing right here. But also what I've found is the creation of a community that says you can take it to the next level for this season of your life, for this chapter, where if you want to get through that weight loss plateau, this is a season where I need you to check your numbers and check in and come back to the keto group and say how you've been doing. That like accountability.
And I think I think you touched on that tribal thing, and we are a very tribal species. We love to not really move in herds, but we love to be part of a small tribe of 50 or 100, 150 people. I think that's kind of ancestrally very appropriate for us. And so for some people, they're loners and they like to do their own thing. They're a lone wolf on top of the hill, and that's fine. But most people, it helps them so much to be part of a Facebook group or to have a meeting they can go to once a month. And for months, Nisha and I would, at the Benton County Library, we would rent out their little lecture hall and we would do a Facebook, and we would go live on Facebook, and we would have anywhere from 20 to 80 people from the community asking questions. And just that, knowing that they had that meeting they could go to and ask that question, is bacon going to kill me or not? I got to know, just whatever their question was, helps people so much to have somebody who they know, who they trust, who they, that's my neighbor, that's my third cousin or whatever, because here in Tennessee, we're all cousins, right?
Right.
But same. But that helps people so much. And so I that's one thing I do recommend everybody: join a Facebook group that you like the vibes, where there's not a lot of keto Nazis and keto police, where people are there to try to help each other and say, hey, you're at the point in your journey that I was a year ago. Let me tell you what worked for me. That kind of stuff it's just worth more than the moon and the sun for people. And so, I'm 100% on board with finding your tribe and hang out with your tribe, because you're going to hear what they have to say.
Right. I think of it as the benefits of the one room schoolhouse, where in one day you were the teacher and the student of your peers. And that enriched you as finding your role as the leader, finding your role as a follower, and knowing that those are just different chapters of who you're going to be in life. And boy, I've loved that keto group. It kind of started as a way to attract a few of my just slumps. They were in a slump and I needed them to, I couldn't give them enough of me to get going. but as a group, they fed each other, and suddenly the weight was off of me as the leader, and I could continue to educate where I needed to, but they bridged one another way better than I could have been the sole provider of their answers and questions to lots of the same ones. You know, you and I probably have answered what's a ketone, I'm sure, over 1,000 times.
Yeah.
But
Absolutely.
speaking of Nisha, how far till she's due?
Her official due date is October the 24th, and we just went and had a maternal fetal medicine scan because she had IVF, and so that makes you by definition higher risk. And so she had to go get a complete scan today and a cardiac and echo on the baby. Everything is beautiful. Everything is gorgeous. And I debated telling the maternal fetal medicine fellow that she was keto, and she's really almost, now that she's past the first trimester, she's almost very red meat, fatty meat, heavy keto again. And I thought about happening to that fellow and saying, hey, by the way, she's keto, but I thought, nah, I'm not gonna get into it today. But everything looked amazing. Baby Berry looks perfect. It's a little boy due in late October, and we're so excited. So yeah, but everything looks great.
Well, as every one of my lectures over the last, I was in Pella, Iowa last week, and today I'm in Rapid City. And again, my part of this education is the brain development and repair. And so I do a section on the power of the health of the mom when the baby's gestating, and what happens to that brain, and how iron replacement and the health of the mom's anemia is super important for the brain development of that baby. So I am praying for your baby boy, and knowing that if you've got keto going in through mama, your baby has an advantage. Congratulations.
Absolutely. Thank you so much.
Well, I have one more question that I before, and then we'll, I think we've had probably 1,000 comments, so I don't know if I can get back to all those, but I have a question for you, and that is, in the world of exogenous ketones, and I've been asked this several times too, do you ever find a space where it is helpful?
Yeah, definitely. And I actually have made 3 YouTube videos about exogenous ketones, and I've kind of evolved a little bit. And so what I would say now is, if their goal is to reverse type 2 diabetes and fatty liver and joint pain and GERD and lose fat, I don't think exogenous ketones play a part in that. I don't think they're necessary. I think if you just eat a real whole food ketogenic diet or carnivore diet, all those things are going to happen for you, and you can save your money and spend it on new clothes because you're going to need them. But if you are a very young child with autism or ADD, or you're a very young child who's had some sort of brain injury, I think that, and you cannot get that child to eat keto, right? You just can't. You can't get them to eat bacon and beef and liver. I think the exogenous ketones play a role in those small children who you cannot reason with. You can't logically say, look, your brain will be better if you eat keto. So I think that plays a role. And then at the other spectrum of age, in the very elderly who are suffering from dementia, who are suffering from Alzheimer's, who are suffering from Huntington's and ALS, I think there is a great role. You know, the last thing you want to do with a demented elderly relative is argue with them, because that ruins their entire day. You know this very well. You cannot argue with your elderly relatives. You need to treat them with nothing but respect. And I think it's very respectful to slip a raw egg yolk in something that they didn't know you just did that. I think that is love and respect. And I think you can do that same thing with butter, and I think you can do that same thing with exogenous ketones. If you have a relative who has dementia, and by God, they're going to have their orange juice and oatmeal, there ain't nothing you going to say about it, put some exogenous ketones in the oatmeal and put some extra butter, and then just pray for them, and that's the best you can do. And so I don't think just the normal person who wants to lose fat needs to spend money on exogenous ketones. But I think there are very specific situations where exogenous ketones can play a very important role in someone's brain health.
Right. You know, I am spot on. I totally agree. When I look at the places where I use exogenous ketones, you know, I'm all about brain health. That's really my motivator. For as much as my book is about the cancer survival of my mom and how much we resurrected her immune system, what I really am fascinated by are the studies that say, if your brain's not working well and it's only using one fuel, as in glucose, if you infuse ketones into their circulation for 4 days, I can wake up 80% of the cells into a new way of thinking and performing. And Ken, I've had people walk out of a nursing home who said they couldn't think well enough to be on a ketogenic diet, but they put ketones in their supplements for 3 weeks, and the awakening was breathtaking. It was humbling to say, okay, whatever judgment I had about man up and do the keto diet the right way, that all kind of judgy thing, I'm all about saying, if you have high blood pressure, I'm going to write you a blood pressure medication until your blood pressure is normal. If I think you need to be on a ketogenic diet and your brain isn't working right, let me just give you exogenous ketones for 3 weeks, and I can prevent you from being on many of the antidepressants because of at any age, their brain works better. It uses 2 fuels now instead of 1. And I can't tell you how powerful that is for their success. The other place that I find that I use them is if they've got a really sick or really, I think of them as sick, chronic illness sick, like they've had diabetes for 30 years. They're on 300 to 400 carbs a day. And I'm asking them to step over the ketogenic diet. I say, all right, you're going to read this book from beginning to end, or listen to it on audio, or watch these YouTube videos, and you have 3 weeks to do it. And during that time, I'm going to put ketones in your circulation so that your mitochondria are ready for you to drop to 20 carbs. And boy, there's several studies that have come out now saying you can awaken the mitochondria shift to using a ketone, and you can see the anti-inflammatory effects so that they don't get that keto flu. I don't want everybody to do that, but I want my really sick patients to not fail. And I found that if I bridge that 3 weeks with exogenous ketones, and then say, now keep it in the cupboard for when you screw it up, because I haven't met anybody who hasn't cheated or screwed it up or said, okay, I just want my carb, and then they're like, oh, my brain is swollen and I don't feel good and my joints hurt again. And I'm like, the fastest way back on track is to put the ketones in your circulation. Do that for like 2 or 3 days, and then you will have no problem saying, okay, you're right, I feel better, I'm going to go back to all keto. And instead of, oh, I don't want to go through the transition, they stay on the carbs for 2 to 3 weeks, and you're like, it's not going to help you. Hurry up, get over this, get over to the edge. So those are the places I use it. But and I found that again, I don't want you for a lifetime. I don't think I have any supplement out there that I want you for a lifetime, but I do think that you should produce ketones for a lifetime.
Yep, absolutely. I love it when people are producing their own ketones. That makes me very happy.
Mm-hmm. So do you do any fasting? Do you do more than 24-hour fasts?
Every now and then I will, and it's usually because of a social or a family thing. I just forget to eat, and then I don't have time to eat, and so I'm like, you know what? I'm just going to fast for the rest of the day. I did that a couple of weeks ago. Typically, I'll have a 18 to 22 hour fasting window, and then I'll have a 2 to 4 hour feasting window. And when you're on carnivore, you can truly feast, right? You're just like a lion on the savannah. He doesn't eat a palm-sized portion of no. I eat as much fatty meat as I damn well want until I am stuffed, and then I stop. And so I get to feast because I fast every day from 18 to 22 hours, and that works very well for me. I'm so productive. I get so much stuff done. But then when I eat, I love it, I enjoy it, and I eat until I'm comfortably stuffed, and then I'm done. Every now and then, I think the longest I've ever fasted was 51 hours. I don't think it's bad. I don't think fasting's dangerous. I think the human body's perfectly capable of doing that. It's not my thing. I don't enjoy doing longer fasts, but I think a lot of people love them and enjoy doing them, and I think more power to you, but it's just not something I do.
So it's totally like a dude to say, I sometimes fast and I kind of accidentally fast. And I'm like, all right, you can just go to hell. That doesn't happen, girl.
Right. Exactly.
Right. So I'm on Misha's side saying, okay, I have to think about it. I have to plan it. I have to tell the whole world I'm doing it.
Right.
Or it doesn't happen.
Yep.
But the fasting really does, when I have patients stuck, it is that place where I'm saying, I know it sounds scary and I know it's a threshold, but if you could step over this line, get to 36 hours, do it, once a week or every other week, you're going to find such a powerful transition in your metabolism. Yeah. And as much as exogenous ketones can bridge you during the high carb time, if you're in a plateau time, boy, that 36-hour moment is powerful. So.
Yeah, and that's, you know very well There are people who have never went more than 4 hours without eating their entire adult life. And so it's really an empowering thing for them to realize, hey, I don't have to eat every 4 hours. I won't die. I'm okay. And it's very empowering, and it's like a personal empowerment when they realize, no, I get to be in charge of when I eat. I'm not a slave to my food. I get to decide when I eat and when I don't eat. And a lot of people love that they can say, no, I'm not going to eat, and that's fine. It's going to be fine. I'm going to be fine, and I won't die.
So I want to hear, where's the next conference that you're going to be speaking at?
Well, I'm grounded until Baby Barry gets here.
Oh, yes,
so I think,
I
think in January we're going to Omaha. There's a low carb conference.
To that.
Yes, definitely, and I hope you can come to that. And then this Saturday, I'm going to be on the big screen at a Canadian keto conference. I won't be there live. I'm going to remotely be on the big screen. But I'm grounded. I can't go anywhere until Baby Barry gets here. I've been given my orders.
You should follow those. I think
Yes.
that sounds like a married couple. Well, you know, I am all about being transparent and saying when doctors like us are trying to do this social media stuff, it looks like it's something we do on the side, but it really requires that we put the time into seeing what is the media saying, what are the latest studies, how do we explain this in a way that patients can understand. And for both of us, we've learned that if we have a book that does do a huge mass of the education, it supports what you do and what I do. So why don't you tell my fans where they can buy your book and what the name of it is, just because we want to make sure that Dr. Ken Berry is well supported.
So my book is called Lies My Doctor Told Me, and it's available where all good books are sold. And there's going to be an Audible version available in late August or early September. It's available right now in paperback and Kindle or Nook, and you can get it anywhere. But the Audible will be out at the end of this month or beginning of next month. I do a lot of work on my YouTube channel. If you just search Dr. Berry on YouTube, you'll find me. I do a lot of Facebook stuff. Nisha and I have a Facebook Live every Monday night at 7 p.m. Central. And so that's a scheduled thing, and you can join us there. I'm also on Twitter. I'm also on Instagram. I'm on Gab. I'm on Vero. I'm on TikTok. You know what TikTok is, Doctor? Yeah. If you knew what TikTok was, I'd be worried about you. That's like a teenage platform. I'm trying to reach teenagers by getting on their crazy TikTok. It is insane, but I'm trying to reach teenagers there. And but I want you to tell. I probably got a few of my people watching this. Tell us everywhere we can find you.
So I'm not as fancy as you. I'm on Amazon only.
For now.
Right. Life has seasons. So my book is Any Way You Can. It's on Amazon. I actually recorded the Audible. Again, something I'd never done before, but turned out great. My story is really my mom's cancer story and how I used the keto lessons to help her get ketogenic at the age of 71. She just celebrated her 75th birthday, and when the story started, she was 10 years into her cancer. She was about to take on her third round of chemotherapy, and her white blood cell count was 150,000. Just last month, she is off chemo, hasn't been on chemo for months, and her white blood cell count was 10,000, which is considered normal.
Nice, very nice.
It's so nice. It's like a blessing. Like God knew how to reward me, which is take good care of my mom. And so the story is the lessons I wrote for my mom. I was never going to publish a book, but my husband kept saying, "You should turn that into a book. That's a really good story. You should turn that into a book." And just like your book, there's lots of reviews of patients saying, "I learned more about the keto diet reading a book than I've ever learned from my doctor." And my favorite stories are when they take the book to their primary care physician and say, "Hey, this doctor wrote this book. Would you read it? Because I want you to do this to me." And I'm like, all right, that's worth praise.
Yeah, I love it when somebody says, "I gave your book to my cardiologist or my endocrinologist." I'm like, I would love to be a fly on the wall. That was awesome. Thank you so much.
Absolutely. Like you and I both get the subtext of what that really means. And I'm like, oh, that's beautiful. Oh, that's beautiful. Well, I really hope I see you in Omaha, but mostly I will pray for a healthy next month and a half for your wife and your unborn son. And may he be ketogenic for his whole life.
Oh, he will. Don't you worry. Thank you so much for having me on, Doc. We're getting a lot of good feedback. Maybe we should do this again sometime.
I would love it. Honestly, 2 primary care physicians, I need your support as much as you need mine to say we might be the only ones that are primary care saying keto all the way till death do we part.
Right. Yeah. I'm like saying, I promise she's not crazy. And she's like, I promise he's not crazy.
Crazy, right?
All right, Doc. It's been a pleasure.
All right.
It's so good to talk to you.
Please subscribe to my channel. And don't forget to click the notification bell so you don't miss out on any new videos. Stay tuned.